Right, everyone, we are at 12:01. I know some folks are still coming in, so maybe I will start talking at 12:02 to give one more minute for people to enter the room. As you're here, I will ask if you're able to kind of just put your camera on, at least for kind of these first couple of moments. We are going to go into a breakout group. And so if y'all can have your cameras on when you are talking with each other. So welcome back to DBT inspired skills that you can kind of use with your clients. This is our second meeting. Our first one was last week where we were talking about mindfulness skills, and today we're going to talk about distress tolerance. So I'm going to try to cover a lot, but also hopefully do it in a way that is coherent. If you have questions, please feel free to throw them into the chat as Stephanie is monitoring the chat, and she will kind of let me know if you have questions. Hopefully people had a chance to try the homework. We had some mindfulness homework where I asked you to utilize the what and how skills that DBT teaches. And to also just kind of pay attention to the options for solving a problem framework. And so I am Dr. Green for folks who don't know or may have forgotten, and I'm a licensed clinical and community psychologist. We are going to do breakout groups, and we'll have about 4 minutes to talk to each other. And here's what I would like. In the breakout group, I'd like you to share with one another how you were able to practice the mindfulness skills, what you noticed when you did practice those mindfulness skills. Perhaps you can each take 2 minutes each, and then we'll talk. Excuse me. And then we'll talk a little bit about what that experience was before launching into distress tolerance. So if you're ready, Stephanie, I'm ready. About their mindfulness practice. Sorry. Would anyone like to share a little bit about their mindfulness practice or about what came up in their breakout group? I know often I hear feedback that mindfulness is easier than it is actually harder, sorry, than it looks and harder than it sounds. That even though the how skills and the what skills are pretty straightforward seeming, when you actually try to apply them in your life, when you engage in the process of observing and trying to do that one mindfully, describing without judgment, and participating fully, but we often run into any challenges. Did anyone find any of that to be true for them?
Oh, I was just talking about in the breakout about using a little meditation piece when I do my DBT's class. And so what I've discovered is that oftentimes it's with your mind wandering, and then just coming back always to observing the breath. And that's a lot of what I've been working on with them. Just observe your breath. I know you're gonna let just observe your thoughts. They come and go, but as they go, sometimes you go with them. So you need to come back, observe your breath. And that's been what the kind of a challenge I've had. But over time, we've done it enough times that they're really starting to get the hang of it, basically.
Absolutely. And the ability to recognize that our minds wander, and that's very natural, and that we can bring our minds back by observing the breath is a really important place of anchoring. Because as we talk about distress tolerance today, we're going to talk about the importance of the client kind of bringing themselves back to the present moment, bringing themselves back, bringing themselves back. Then when you're able to bring yourself back to the present moment, that actually makes you more likely to be able to use your skill. And in distress tolerance in particular, you really need to be able to use your skills to navigate crises, to navigate unwanted situations, and to navigate distress. So mindfulness is really a skill that all of the other skills build on top of. And the other piece that's also important is when we recognize that our minds wander, to allow ourselves to have compassion for that. that clients might say, well, I'm supposed to be doing this and I'm supposed to be doing it this way. And often our minds have other agendas. And so to be able to say, well, my mind is doing something that I'm not really in control of, and I can have compassion about that, and I can kind of return to the exercise. So all of those things are important. Thank you so much for sharing, Karen. All right, so let's get into talking about distress tolerance. I'm sorry for all of the screens that are present. And people can see that okay? Yes? Okay. All right. So we have done some review of the homework. I'm going to reintroduce the 5 options for responding to a problem, introduce meanings of distress, talk about several distress tolerance skills, introduce reality acceptance skills, and radical acceptance. All right, so again, the problem-solving framework is important because it guides us in our work with clients and in how we think about which skills to use when. So the first step in the problem-solving framework is to solve the problem. In order to be able to solve a problem, we have to be able to identify the actual problem. Once we're able to do that, then we want to bring in problem-solving skills. If we can't solve the problem, then we have to feel better about it or try to feel better about it. And that's where we bring in emotion regulation skills. If we can't feel better about the problem, we might just need to tolerate it. And that's where we have distress tolerance skills, which is really about how can I survive and make it through this moment without making things worse. Of course, we can just stay miserable where we use no skills, or we can make things worse where we use skills ineffectively, or we use ineffective skills. So what kinds of situations call for tolerance in the context of DBT? Situations where we feel overwhelmed, triggered, or disoriented. Urges as well as emotions can be opportunities for distress tolerance. And so if you're working with someone, for example, who is managing addictive behaviors, it may present an opportunity for them when they notice their urges to tolerate that distress. Because often when we're trying to shift addictive behaviors, there is a pattern of I have an urge and I do the behavior to meet that urge. And so what distress tolerance says is you can have an urge, and if you can learn the skills to manage that urge, the urge will pass. The craving will rise, it will plateau, and the craving will begin to fall away. But we don't get to the decrease of the craving if we meet the craving at its when it comes up. So allowing clients to urge surf, right? And they urge surf using distress tolerance skills. The same thing can be true for heightened emotions. Sometimes our clients experience crises that are happening outside of them, but sometimes the crises are happening inside of them. The emotions are so overwhelming that they have trouble accessing problem-solving skills. And so distress tolerance skills can be helpful to kind of help them navigate those really heightened emotions so then they can access some other skills for managing. Crises or emergencies, of course, these situations that come upon us with surprise and they're out of our control. That's when we need to learn to engage our distress tolerance skills. Unavoidable situations like the death of a loved one, and situations that may significantly impact the client, like a job loss. They have no control over that, but they have to learn how to navigate it anyway. And situations that the client cannot improve right away. So there might be a circumstance where perhaps they have heard that they have to go on a trip somewhere and they are really worried about going on the trip. Maybe they have trouble with travel and they have to fly. And they're going to be on the flight for 4 hours. That is not a situation that they can improve right away. So they have to learn how to manage distress in that moment, even though the moment is 4 hours, so that they can navigate through that situation as successfully as possible. So these are the kinds of circumstances that we think of engaging distress tolerance skills. And it's important to teach this to clients so that they are using their skills in appropriate contexts. Remember, one of the assumptions of DBT is that skills are best learned when they are practiced in appropriate contexts. And so that's why I like to set up which are the contexts that are most appropriate for these skills. The fear of suffering is worse than the suffering itself, Paulo Coelho. And I really think that this speaks to what we were talking about a little while ago about mindfulness, that so often the anticipation of suffering, the anticipation of the thing is worse than the actual thing itself. And so distress tolerance says, if we allow ourselves to experience the thing, whatever the thing is, we actually can find that there are skills for navigating that versus staying in the anticipation of it or the rejection of the experience. Often, clients might try to deny, ignore, delay, avoid painful experiences rather than allowing themselves to engage with them in the present and utilize their skills to manage them. Many clients don't have skills to effectively manage crises or significantly distressing situations, and distress tolerance skills seeks to answer that. Many clients may manage crises or distressing situations by using ineffective skills or essentially making things worse. And so when I was working at the VA and I was working on the DBT team, many of my clients were trying to manage their distressing situations, but they were doing so through self-harm, substance abuse, maybe disordered eating. These were tactics, they were techniques, they were skills for them. And so when I was able to see, when the team was able to see those skills through that perspective as adaptive responses, as ineffective skills, it really allowed us to take those skills in context and to examine when our clients were most likely to engage in self-harm, for example. And then when we had that information, we could help our clients see that there are other ways for managing this particular moment of distress. Maybe you normally would have scratched yourself. Maybe you normally would have cut yourself. Here's another skill that you can use instead of this skill, because ultimately this skill of self-harm will be against the goals that you have, will not allow you to solve the problem at hand, will delay addressing and solving what needs to be solved. Whereas these distress tolerance skills will give you some space, will give you greater access to your problem solving abilities rather than self-harm, for example. Often, when clients use judgment, avoidance, or blaming as a way of managing crisis, these actions can make a crisis even worse. If I am judging a situation, I am standing outside of it, and I'm often not dealing with what the situation is. The same with blame. It's your fault, it's my fault. That is actually much less effective than figuring out what the problem is and trying to move forward with that. And we actually can become even more overwhelmed by engaging in these actions rather than using the skills. Crisis situations, of course, can make accessing skills much harder because crises by their nature activate us. We often become really overwhelmed. And so crisis distress have alternative skills, they may act on those urges. So client to stop drinking, but I don't give them any other skills for managing the distressing relationship that they're in, I can likely expect that they will resort to what they have been using, the tools that they have. And so if we want our clients to have other tools, then we have to help them in finding them, utilizing them, and utilizing them effectively. Crisis situations often activate the body and mobilize a fear response. Distress tolerance skills aren't just about navigating thoughts and emotions. They're also about navigating what happens in the body. Sometimes what's happening in the body becomes so compelling that it is more difficult to manage some of what's happening with our thoughts and our emotions. And so a distress tolerance skill says, okay, let's bring the body online and let's intentionally pay attention to what's happening in the body so that we can access some of these other things that we need to. So we want to grow a client's capacity to tolerate distress. We are not in the business of helping clients avoid distressing situations. Pain is a normal part of human experience, but suffering isn't. And so in DBT, we talk about, helping clients to experience normal pain as opposed to the overwhelming, life-shattering, paralyzing pain that can happen when emotions are out of control or when we make crises worse. So we want to help our clients recognize that they have capacity to manage pain, to manage distress, and that we can help them grow their capacity. Clients can learn to confront and skillfully maneuver crises rather than avoid them. They can also become more confident and competent in navigating these crises when they see that they can survive them. So after practice with navigating crises successfully, clients begin to build up their own kind of resilience. They begin to learn that they really can utilize skills that they've been taught, and they can see themselves through crises in a way that doesn't make them worse. If clients can learn to manage their body and their emotions during a time of crisis, they can lessen their reactivity, right? So if I am not having a panic attack every time I'm triggered, then it is much more likely that I will be able to navigate my triggers in a way that doesn't make things worse for me and doesn't kind of paralyze me, doesn't derail my day, doesn't derail my week. And so the managing of the client's body reactivity is also a way of building resilience for managing future situations where they might be out of control, for example, or in crisis. When clients find themselves in crisis, we often see the use of risky or dangerous behaviors. And so it's especially important that we are kind of giving the client lots of options for tolerating distress, because they are going to encounter an overwhelming situation again, either tomorrow, next week, in a couple of months. Overwhelming situations come up. And so when they have the skills to navigate that, they can be effective in doing that and lessening their dangerous behaviors. What do clients gain from better distress tolerance? More adaptive coping is an example of improved emotion regulation. We aren't just teaching distress tolerance skills only for managing crises. These skills are actually generalizable. So lower levels of distress tolerance have been associated with poorer life quality overall. So if you don't manage crises well, then it's likely that you have a lower kind of quality of life, which means, of course, increasing your ability to tolerate distress can increase your own perception and experience of your life overall. And of course, that makes sense. There are always situations that are out of our control. There are car accidents, a tree falls on the house, there are deaths in the family, there are unexpected events that happen at work. And if every time a crisis surfaces, we manage that crisis ineffectively, then it can absolutely impact our quality of life. Whereas if we have the tools and the skills for managing these crises, big and small, then that does make it more likely that we will have a better handle on, a better experience of the lives we're living. Low distress tolerance also seems to be a risk factor for particular psychopathologies, including borderline personality disorder, but not only, also substance use disorders, anxiety disorders, and disordered eating. If I'm not tolerating my distress well, and I'm using tools that are ineffective, that can leave me more vulnerable to certain kinds of psychological distress. Research also has shown that low distress tolerance significantly predicts the use of maladaptive emotion regulation skills. So if I'm not managing distress well, then I'm probably am not managing my emotions well either. And so there actually is a relationship between distress tolerance and emotion regulation. So we're not just teaching the skills to get through the crises, we're also teaching the skills to help our clients live better lives, feel more competent and confident in their lives, reduce their vulnerability to psychological distress, and to help them increase their emotion regulation. There are certain times when we want to use skills and certain times when we don't want to use skills. Distress tolerance skills, they are ideal for circumstances that are short-term, highly stressful, that need immediate attention, that cause intense emotional responses, when acting on urges would make things worse, when emotion mind is overwhelming, but skills are needed, when clients are overwhelmed, but they have things to do and tasks to complete, when clients are overwhelmed just in general. So for example, you are driving on 285 and your car breaks down, and you have to move your car over to the side of the road, or you have to wait for the hero services to come. That can be an extremely overwhelming crisis situation, but there are things that you have to do. You can't just sit in your car when your car is broken down in the middle of the highway. You have to call your insurance. You have to figure out if you can move your car out of the way. You have to look around at your car and see if there's any damage, right? There are things that you have to do. And so that is a time where distress tolerance skills are extremely useful. We don't want clients to use the stress tolerance skills for everyday problems, for solving all problems, or for feeling more connected to and fulfilled by life. Distress tolerance skills are for short-term problems. They are not for the problems of every day, like long-term financial stress, for example. They're also not for solving all problems. Distress tolerance skills are not necessarily problem-solving techniques. They are more deactivating techniques. They are also not the skills that will get our clients to feel more connected to or get them to create more meaningful lives. Those are other kinds of skills. The goals of distress tolerance are to survive crises effectively, practice accepting reality as it is, recognize that clients have a choice in terms of giving into their urges and their overwhelming emotions. And distress tolerance skills can also allow clients to develop their own goals for why learning distress tolerance skills would be helpful. So clients can come into me and they can tell me all of these different circumstances that are happening in their lives. But if you remember last week, we talked about helping them identify target behaviors, those behaviors they want to increase and the behaviors that they need to decrease. That, of course, is not the end of that conversation. The next part is why. Why do you want to increase your ability to tolerate distress? Why do you want to decrease your self-harm? Why are these things important to you beyond me as your therapist telling you that? And so we can put distress tolerance skills in the same category, that we can give clients the opportunity to determine for themselves why it would be important to learn these skills. In the space between stimulants and response, there's freedom. And if distress tolerance skills do nothing else, if you remember nothing else from today, remember that distress tolerance skills give clients the opportunity to have some space between what has happened and what they do next. That's what it does. And so they do that by helping bring down body reactivity. They do that by bringing the client back into the present. They give clients space between what happened and how they respond. So the first distress tolerance skill is really a skill that is about managing the crisis right now, and it's called the stop skill. These are all crisis survival skills, and they're not about directly addressing the crisis, but they are designed to increase coping skills for successful survival of the crisis. That's kind of the first set. And so the stop skill, which I'll go over soon, is in the set of skills that's a crisis survival skill. But the second set of skills are about accepting reality as it is. And that can be a more difficult skill to learn. We practiced a little bit of accepting reality as it is with our mindfulness work last week. Crisis survival skills and distress tolerance skills talk about accepting reality as it is at a bit of a heightened level, because the reality that we are asked to accept when we're talking about crises and overwhelming situations are often the crises and the situations that might be life-changing, life-transforming, and often we do not want to accept. So we have our crisis survival skills, and then we'll talk about the accepting reality as it is skills. All right, so I think we actually might have a little time to look at pain versus suffering. So I'm going to stop sharing for a moment. So when I did this, I had to also share audio. Okay, so I'm going to share this and let me know if you can't hear me or hear the video. Share computers. Cool. Let's see what happens.
It's something, we experience it in one of
Okay.
three ways, as either pleasant, unpleasant, or neutral. If the experience is something we find pleasant, we tend to react with attachment. We want to hold on to the experience and prolong it and have more experiences like it. And if it's something we find unpleasant, we tend to react with aversion. We want it to stop or to avoid it or to make it go away. And if it's something we find neutral, we tend to react with a lack of interest. Perhaps we don't even notice it or don't care about it or look for something new or more interesting. Now let's look at what happens when we experience something unpleasant and react with aversion. There's a Buddhist teaching about how the way we react to pain and unpleasant experiences often ends up making things worse. When touched with a feeling of pain, the untrained person sorrows, grieves, and laments, beats their breast, and becomes distraught. And so they feel two pains, just as if they were to shoot someone with an arrow, and then right afterwards were to shoot them with a second arrow, so that they would feel the pain of two arrows. The first arrow causes us pain, and the second arrow causes us to suffer. In this story, the first arrow represents physical pain, but this first arrow can be any sort of unpleasant experience we have. And so you might experience this first arrow in the form of an unpleasant body sensation. Your heart skips a beat or starts to speed up. You tense up. You get a lump in your throat. Or you start feeling hot. Or the first arrow might come as a feeling or emotional reaction. There's a wave of anxiety. You get stressed. You start to feel sad. Or you get angry. Or this first arrow might strike as a negative thought. What am I going to do? I can't take this anymore. I'm such a loser. That's so unfair. And this first arrow is outside of our control. We can't prevent ourselves from having unpleasant experiences that cause us pain, but it's what happens next that's important. And if we respond to this pain with sorrow, grief, and lament, or by beating our breasts and becoming distraught, then in addition to feeling hurt, we start to compound things, and it's our negative reaction to the pain of that first arrow that initiates the second arrow that causes us to suffer. So there's some sort of negative trigger, like we remember all the work we need to get done this weekend. And then the first arrow hits as an anxious thought. And then we get struck by a second arrow as we start to feel anxious, and our heart starts beating faster. Or that first arrow hits as some stress, and we start stressing out and tense up.
So distress tolerance is really about paying attention to the first arrow and lessening the likelihood that we're going to get into the second arrow. How can we encounter pain as it is without then creating suffering? Because pain is not a choice, but suffering can be. So the stop skill. The stop skill is useful for encouraging clients to give themselves some distance between a situation and their reaction to the situation. And in this space, we're trying to give them some access to wise mind. We talked about the 3 states of mind last week: reasonable mind, emotion mind, and wise mind. And wise mind is where our values live. Wise mind is where our best advice lives. And so the stop skill slows things down for the client so that they can access wise mind. The first part of the stop skill is to stop doing what you're doing. If you're yelling and screaming, stop. If you are worrying and putting yourself kind of in a tizzy, take a step back, stop. After you stop, take a step back, literally or figuratively, right? So you might remove yourself physically from the situation, or you might have to kind of take a step back from the situation in your mind. You're doing this so that you can observe what's happening inside of you and outside of you. Here's where that observe skill comes in, that I'm wanting to pay attention to not only the situation itself, but also my responses to the situation itself. I was recently in a session with a client, and we were talking about what she was observing on the outside, and then what she was telling herself about what she was observing on the outside. So that's paying attention to externally, right? This person is saying this, or this person is doing this. But also internally, I am having certain responses to what this person is saying or doing. And some of those responses are influenced by what I am telling myself. But we don't get there without practicing the observe skill. P, proceed mindfully. So I've stopped what I'm doing. I've taken a step back. I've engaged in observing what's happening inside and outside. And then I am making a decision about how to respond. So my sister calls me and says, you know what? Like, I am so sick of every time mom asks you for something, you always have something else to do. Maybe my normal response is, you know what? Like, this is none of your business. Mind your own business. This has nothing to do with you. But if I engage with the stop skill, I can say, okay, hold on one second. I'm stopping. Let me call you back. I'm taking a step back. You know what? My heart is beating fast. I feel a tightness in my chest. I'm observing what's happening. I don't want to argue with her. I think I would just like to let her know that mom and I are working this out. I'm proceeding mindfully, right? So allowing yourself to think about practical ways that you can share an example with your client of how they can use the stop skill. It's a totally hypothetical situation, by the way. The next skill is the pros and cons skill. We talked a bit earlier about the decisional balance, helping clients recognize that they can always choose whether or not to use skills. And so the pros and cons skill is applicable generally for DBT skills, but also quite specifically. So when we're paying attention to pros and cons in the context of distress tolerance, we're asking, what are the urges in the moment based on the present emotions? What does your client want to do? I want to cut myself. I want to throw something against the wall. I want to yell and scream. I want to hug this person. I want to key this person's car, right? Like, what are the urges? I want to have a drink. I want to smoke a joint. Consider the pros and cons of acting on those emotions or urges. I want to know what the short-term consequences are and long-term consequences are that are positive. So if I do key this person's car, well, they'll know that they can't mess with me. If I do take a drink, I will have a sense of relief from these emotions. If I do yell and scream at this person, then I will have a sense that I've like let off some steam. And so I'll feel less pressure inside. But then you also want clients to consider what the cons are, short and long term. Short term, if I key this person's car, then I've just escalated a situation, and that may not go too well. If I take a drink, I've said that I don't want to use alcohol as a coping mechanism. And so I'm going against something I said was important to me. If I yell and scream, the other person is probably also going to respond to anger, and then we're going to end up in a yelling match. So the pros and cons allow both the client and the clinician to recognize that they can make informed choices one way or the other about how they respond to their own urges and their own emotions, and really allows clients to weigh their options rather than acting automatically. The next skill is to distract with accepts. Here's the thing that I think is important about distraction. Sometimes we talk about distraction as always negative. There is a function to distraction. There are some times and some moments where distraction might be the most appropriate answer, particularly when we are in a circumstance that is distressing and out of our control and might remain outside of our control, where our problem-solving skills might not really be helpful for managing the situation because we don't really have control over it. So sometimes distracting or avoiding allows us to disconnect from the situation for a bit before we engage with it again. Now, we don't want to use distraction and avoidance all the time, because then we're just using one tool, and we never need only one tool. We always need to use the best tools in the most relevant situations, but distraction can be useful and helpful when it is used as a tool. Accepts, activities, contributions, comparison, emotions, pushing away, engaging with thoughts, managing sensations. Activities. You may focus on the task at hand. Watch television, play games, go for a meal, call a friend. But activities refers to actually doing something. So if I'm distracting, I'm going to actually do something physically to distract. Maybe one of the things I want to do is contribute to the life of someone else in some way. So maybe I'm feeling really distressed because a parent has been diagnosed with a chronic illness. And we know that we have kind of a long road ahead. And every once in a while, my fear and anxiety rises up, and I get to this place of feeling really overwhelmed. In those moments, those might be times where distress tolerance skills are appropriate. And if I allow myself to, okay, well, I'm going to leave my house and I'm just going to do a nice thing for the first stranger that I see. I am contributing to the life of someone else in another way. I'm showing support for something or doing something kind. Does it solve that my relative has a chronic disease? No. Does it solve my grief or my fear about that? No. But does it allow me to disconnect from my distress for a moment and to do something that can actually help bring about a feeling of positivity, maybe? Yes. I could also compare myself to another time when I felt differently. Or I might compare myself with others who are less fortunate. Personally, with the comparison piece, I think it is most useful to help clients compare themselves to themselves. So maybe in this moment, I'm feeling so distressed that I can't really seem to think straight, but I can compare myself to another time when I felt distressed. And when I allowed myself to manage the distress, I then came out on the other side, right? So I'm comparing my today functioning to previous functioning. I can also compare my skills now to what they were before. I can use my own experience as a point of comparison. Emotions. I can engage with emotional material. So sometimes what happens when we feel overwhelmed is we shut down. And in shutting down, that might be temporarily useful, but long-term it's not. And so if I engage with emotional material, like I read emotional books and watch emotional shows and listen to emotional music, that one can get me in touch with my emotions in that moment. And also it can help me feel not so alone in my emotional experience, because I am experiencing this unique circumstance for me, but there are so many other people who have been in the experience where a loved one has been diagnosed with a chronic illness. And so by allowing myself to engage with emotional material, I also allow my experience to be universal rather than just unique. I can temporarily push away thoughts of the situation. I can try to block them or imagine putting the situation in a box. I am trained in EMDR, and one of the metaphors that we use is that of a container. And so at the end of each session, I ask my clients, is there something that you need to put into the container? And I have them visualize this container, its size, its shape, colors, if it has a lock on it or not. And I have them actually mentally open the container, put whatever they need to into the container and close it. And this pushing away of thoughts is the same kind of idea. You can also help clients to engage with their thoughts. And that doesn't mean engage with their thoughts about the event. That means engage their cognition about something else. So read books, do a puzzle, count, do Sudoku, memorize something. If our clients are so activated that it's hard for them to control their emotions, if you have them do a puzzle, or have them think about their favorite recipe, or have them read a blog post about something, that engages the mind. And it engages the mind in a way that distracts the mind, but also brings down their overall activation. There's also a way of changing the sensations. Have the client take a shower, go out in the rain or the snow, hold ice in their mouths or in their hands, rub ice on the back of their necks, really allowing themselves to take control of their physiological reactions and responses. Number 5 is a tip skill, which is right in line with taking control of physiological response. The tip skill is extremely useful when our clients' bodies are activated in ways that overwhelm them. They have a presentation that they have to give, and they're feeling so anxious that they don't know if they can do it. Or maybe they're going to a group therapy meeting and it's the first one and their social anxiety is really kicking up. Have them go to the bathroom and submerge their face into cold water, right? And hold their faces there for a bit. Utilize intense exercise where they run in place, right, for 5 minutes and really kind of increase their heart rate. Engaged in pace breathing, where they allow themselves to bring their attention back to the breath and maybe count the breaths, right? Counting each exhale, 1, 2, 3, 4, and then counting each inhale. Or even paired muscle relaxation. Paired muscle relaxation, I have a video option within the handle set you'll see, but it's a video of a woman guiding you through paired muscle relaxation. So we're pairing tension with the breath and with release. And so that is another way of just responding physiologically to the ways in which bodies can become activated in stressing and overwhelming situations. Self-soothe with the 5 senses. And self-soothe brings clients into the present moment and allows them to have choices about how they want to manage what's happening in the present moment. So you want clients to engage their sense of smell, right? Notice potent, compelling, or pleasant scents. When I worked at the VA and I would work with veterans who would get really activated and overwhelmed when driving, I would ask them to carry essential oils with them, or to use Altoids, which are those very strong mints, or I carry like some cinnamon or a spice mix and put it in their car so that when they start to feel overwhelmed and panicky, they can smell this very strong smell, and that brings them into the present moment. It takes them out of whatever memory they were caught up in. You can also engage the sense of sight, looking at a beautiful scene, looking at pictures or a candle flame. The sense of sound, becoming aware of sounds, playing certain music, engaging with audiobooks, podcasts. The sense of taste, eating some of their favorite foods. I, for one, love tea, and so I often have chai or some kind of tea with me. Really allowing clients to begin to imagine what are the sights, the sounds, the smells, the tastes, and the kinds of textures and touches that are calming for me. And allowing clients to kind of build a toolkit of that before they get into a stressful situation. So when the veteran is in their car and they're feeling triggered, that's not the time for them to try to figure out which sense to engage. That's the time for them to say, oh yeah, Dr. Green and I talked about this. All right, so I'm going to grab my lavender essential oil. I'm going to smell that. And I'm going to pop this Altoid because that is both taste and scent. And I'm also going to kind of turn on my favorite station, right? So I'm engaging several of my senses at the same time that bring me into the present moment and bring down my physiological activation. So helping clients to prepare a toolkit for themselves so that when they come to the place where they need to utilize self-soothe, they have an idea of what's soothing for them in these 5 categories. Improving the moment. Imagery, meaning, prayer, relaxation, one thing, vacation, encouraging, and rethinking. DBT loves acronyms. And so this whole training is alphabet soup in many ways, but the acronyms can be really helpful once clients learn them for helping them to quickly retrieve the skills when they need. So using imagery is really engaging in the imagination to soothe distressing emotions, such as through visual imagery. So I often talk about worry and anxiety as a misuse of imagination. You're using the imagination to kind of torture and punish yourself. And so clients can also use their imagination to bring them self-soothing and a sense of safety. And so doing kind of a calm place visual imagery or the safe place visual imagery is really helpful for that. Also, considering the possible meanings of a difficult situation. So perhaps clients may be seeing a difficult situation only one way, and there may be other helpful, more helpful interpretations of crises that they can engage with. Utilizing prayer or meditation or moments of reflection or silence to seek strength and support in kind of a inner way or in a way of connecting to a larger sense of meaning or purpose if clients have that belief system. Also engaging in relaxation activities like as taking a hot bath or shower, taking a walk, but doing something intentionally to kind of bring you into a state of relaxation. Focusing on one thing at a time can be really helpful. It can put you in a meditative place. Some people have talked about vacuuming as being a meditative activity, and it really can be. It's the same motion over and over and over again, and you don't have to think too much about it. You can just kind of do the task. And so encouraging clients to do one thing at a time. Temporarily distracting themselves from the problem, we call taking a vacation. And also encouraging and rethinking. So helping clients to encourage themselves around a situation and reframe it. This is really hard. You're doing the best you can. You had no idea that this was going to happen. You are capable and skilled. You have access to your own resources. You're not alone, right? Really helping clients to think about ways that they can encourage themselves. So we've talked about kind of the crisis survival skills, right? Stop, tip, distracting with accepts, self-soothing, and also the last skill of improving the moment. Those are different than reality acceptance skills. Reality acceptance skills are skills for acceptance when change is not possible. So my relative is diagnosed with a chronic illness. That's not changing. That is a circumstance, a situation that I will have to learn how to accept. And so the reality acceptance skills are really about that. How can we learn to tolerate and or accept the unacceptable? Mindfulness is really where this comes in. Radical acceptance, turning the mind, and willingness. Accepting reality as it is. So I wanted to include compassion here. It's not usually listed as a skill in distress tolerance, but compassion is often a really important component of acceptance because often compassion requires us to not only notice our own experience, but to notice the ways in which our own experience is connected to the experiences of others, which can help us accept reality as it is. So for example, I teach mindfulness and have practiced mindfulness for many years. And there's a grief meditation that when a person is experiencing grief, let's say they have lost a parent, there's a way in which grief can feel very singular and can feel very isolating. The grief meditation encourages the person who is grieving to acknowledge their own grief and then to think about everyone that they know who is grieving a loss, and then to a loss that is the same, right? Also grieving the loss of a parent. But then to think about everyone that they know of who might be grieving a different kind of loss. Maybe it wasn't their parent, maybe it's the loss of a child or a sibling or a friend. And then to begin to think about even more people that they don't know who are probably grieving or definitely grieving at that particular moment. And what the grief meditation is doing is it's engendering compassion, compassion for one's own pain, but also connecting one's own pain to the pain of others. To have compassion means to empathize with someone who is suffering and to feel compelled to reduce the suffering. The same is true for oneself. Compassion is often interrupted by judgment and hindsight bias. How often will you hear someone say, you know what, I should have known, or I just had a feeling that that was going to happen. If I had followed my feeling, that wouldn't have happened. I wouldn't have been in that situation. That kind of speak can interrupt a person's understanding of where they were at that moment, can interrupt a person looking at themselves with gentleness and kindness, which essentially is what compassion is, treating oneself and others with gentleness and kindness. And compassion is a practice. We don't automatically fall into compassion. It's something that we have to be intentional about and pay attention to. And as we become more compassionate with ourselves and other people, we also become more able to accept reality as it is. Radical acceptance really speaks to being able to accept reality as it is fully and accepting in the mind, in the body, and in the heart. It requires accepting that the past is what it was. The future has some limitations. Mostly everything has a cause. And not pushing back against what reality is. Sometimes our thoughts about what acceptance means interfere with the actual practice. Acceptance is not agreement. If I say that I accept that the past is what it is or was what it was, that's not the same as saying I agree that everything that happened in the past was good, right? Or I wanted it to happen. Acceptance is not defeat. It's not resignation. Acceptance is active. It's not minimizing the significance of an event. We can recognize that, yes, this happened, and it was a really painful thing that happened. It was a really horrible thing that happened. It was a really surprising thing that happened. And rather than fighting against the fact that this happened, I can accept it. Acceptance doesn't mean that you don't want to believe in or fighting for change. I can accept that racism exists. I can accept that heterosexism exists. I can accept that transphobia exists. And accepting those things doesn't mean I don't want them to change. But starting with acceptance actually makes it more likely that I'll be able to engage with change because I'm not starting from a place of denial, for example. I'm not putting my energy towards fighting the reality of a thing. I'm accepting that this thing is real, and then I'm moving into figuring out what to do next. Acceptance often allows a more honest exploration of available options because we're putting our energy towards what is, and so we can notice what's possible and what's not. It also can allow clients to tell the truth about the decisions that they made, their own motivations, their current decisions, their own worries, fears. It can really bring us into a space of authenticity and honesty. Turning the mind is the next kind of radical acceptance skill. Choosing to accept, again, is not the same as agreement. So, and choosing to accept is not the same as acceptance. I can choose to accept and still not accept. And so it's a practice, and turning the mind is one of the ways that we practice. So you want to notice the ways that the client is fighting against accepting, create an internal commitment to accepting reality as it is, practice choosing acceptance and practice accepting, and then to create a plan to notice and adjust when accepting is not happening. There is the idea of the cycle of grief, and acceptance is often a part of that. And sometimes there's the assumption that once we get to acceptance, once we've arrived, now we have accepted. But those of us who have done this work for some time have seen clients, and those of us who have experienced grief have had the experience of knowing that sometimes we're in acceptance and sometimes we move out of acceptance, right? And so turning the mind is really about paying attention to the process of acceptance and how it is and isn't happening. Willingness. Willingness allows you to do only what's needed in the moment, nothing more and nothing less. It requires acceptance of the situation. Acceptance of the situation allows us to know what's needed in the moment. It requires listening and then responding to the situation from wise mind. Again, wise mind is the value place. Observe willingness, practice turning your mind, and involve the body with half smiling or willing hands. Half smiling is exactly what it sounds like. It's having a semi-smile, and willing hands, sitting with your hands up in a stance of openness. The reason we involve the body is because acceptance is a whole body experience. It isn't just cognitive. Remember, choosing to accept is not the same as accepting. And so not everything that is faced can be changed, but nothing can be changed until it is faced. And so that's where we end up with our distress tolerance skills, that these are really skills about accepting the moment as it is, tolerating the crisis or distress of the moment, navigating those crises effectively, not resorting to those things that make crises worse, and coming to a place of radical acceptance when we have to accept what is because we don't have any control over it, or the circumstance may or may not change, but we don't know if it's going to change. So we want to encourage clients to have as much space as possible between stimulants and response, and to know that while they can't choose pain, they can choose suffering or not. So I hope that you've been able to gather something from today. The hour always goes by faster than I imagined. Look out for some handouts that are going to kind of summarize these skills. And as always, I'd like you to choose a skill to practice. Our skills are best utilized when we practice them in relevant situations. So choose a distress tolerance skill, practice it for yourself. And I encourage you to practice it for yourself before you teach your clients. DBT really asserts that we are not as good as we can be teaching our clients skills if we don't utilize them ourselves. So take care of yourselves. Look out for some emails from us. If you have any questions, please feel free to email them over and I will try my best to answer them before the next session. And next session, we will talk about emotion regulation. Take care of yourselves. Thank you.